If you're one of 4 in 5 Australians suffering with back pain, you probably should listen to this video. You might find it interesting. Hi, I'm Dr. Mario from Vitality Semaphore in South Australia, and we're great at helping people with their back issues and improving their vitality naturally through chiropractic. So let me throw some information that you might find interesting. If you have back issues, now that can be your neck, your mid back, or even your lower back, generally it has an impact on your quality of life. You don't get used to the pain, you get used to not doing things that you want to do. So you're not out playing with your kids, you're not out doing sport, you're finding it difficult to remain autonomous if you're a part of the older population, and it has a real impact on your psychological stress. It sort of nags at you all the time. You feel like there's no hope for better. You can't plan for the future, you can't plan to travel, you can't do long trips, you can't plan days that are too active. It's really terrible. But you're not alone. We're talking about 4 in 5 Australians that have suffered once in their life. There's 1 in 6 at the moment that are suffering like that. And it's interesting that a global study found that the greatest burden of disease in Australasia in particular is actually back pain and osteoarthritis. So you reduce your quality of life, you increase your stresses. Now, what can you do about this? Well, there's a lot of studies that have been done in terms of how do we improve people's back problems, and really it's not really conclusive. So they've got this term which is called chronic primary lower back pain. So it's non-specific back pain. And 8 in 10 Australians have suffered with non-specific back pain. It can affect, like I said, neck, thoracic, or lumbar spine. The major part of the population suffering is people between 35 and 55, but the truth is it affects everyone. In the study, it says it's the working population, also the elderly population are particularly affected, and also the inactive. But in practice, we see lots of athletes with similar stuff as well. So you're either doing too much or too little, and there's no real simple solution. What we do know from the research is that if you're taking medication for your back pain, that you're more likely to allow it to get worse and faster over time, and it can actually have a rebound effect where the medication stops working and everything feels worse. So it's a no-go, especially when it's prescribed like opioids and stuff like that. A review of recent studies has found that conservative care is key. Now you think about it, it's chronic non-specific back pain. So you have a blood test that doesn't really show anything. You have an x-ray and it doesn't really show anything. Nothing's broken, nothing's dislocated. But you think about how a body works, right? So you've got all these joints moving together, you've got muscles that move, bones, they move them at the joints. So if joints aren't moving properly, muscles are working even harder. You've got these confined spaces in these joints which have capsule all the way around them, and then you get inflammation and swelling. You've got nerve structures which pass through the joints, especially around the spine area. So if you've got a spine that's not moving, not in alignment, and it's causing nerve pressure, then you've got a thing where your brain's not getting information about what's happening in that area, and it's not able to transmit information to heal that area or start a healing process or to correct the problem, and you get something that becomes chronic over time. Now, there are lots of different reasons you can have back pain. We do know that if your spine's not moving properly and not in proper alignment and it's affecting the nerves, they call it chronic non-specific back pain. Chiropractors call it subluxation. So if we check your spine and find that there are mechanical issues that are affecting the nerves, and we can make improvements to how things are moving and the alignment, and we can reduce stress on the nerves, then there's a good chance your body will get better, which is why the research is finding that conservative care can have a better effect than taking something that's going to reduce your symptoms in the short term. You're taking medication, it's a slippery slope. It feels good at first and then it has no impact at all. You improve the function of your spine and your posture, and then you've got improvement happening over time, less reoccurrences, less frequency, less duration, and less intensity of problems. Now, obviously there's do's and don'ts. There's lots of things. There's so many different factors in terms of lifestyle and what you can be doing to help yourself and what you are doing to make things worse. We know that there are 400,000 chiropractic consultations in Australia every year, and with Spinal Health Week, we're just making it aware that you can get your spine checked and see whether or not your quality of life is being affected by subluxation, by your spine not being as healthy as it should be, and maybe chiropractic can help and get you off the meds. Every case is different. It's worth getting a check. Most of the time people say, I wish I'd discovered this earlier because it's helped me so much. Get out there, call an Australian Chiropractors Association chiropractor and book for a checkup today. I'm Dr. Mario from Vitality Semaphore. All the best.